I'm Anna Ignatovic from Translational Gastroenterology Unit in John Radcliffe Hospital in Oxford, and I'm with James East, also from Translational Gastroenterology Unit in Oxford. We will be discussing a study that was performed at St Mark's Hospital in London on position changes. The study entitled Dynamic Position Changes During Colonoscopic Withdrawal Increase Adenoma Detection, a randomized control trial. Dr. East, can you tell me the background to your study?
This study essentially came out of Christopher Williams' early experiences with colonoscopy in the early 1970s, where he had a lot of interaction with his radiology colleagues who were performing barium enema. And one of the findings at double contrast barium enema was that in order to get good views and high quality luminal distension, they would change the patient's position so that the area of interest was at the highest point, causing gas to rise and fill the lumen, with fluid and debris falling away to dependent areas, giving high quality images. And Dr. Williams' thinking was that we should perform similar changes at colonoscopy to improve the mucosal view. And indeed this has been generally accepted as part of expert opinion, although anecdotally it's relatively rarely performed in clinical practice. We have, in a previous study published in Gastrointestinal Endoscopy, shown that by doing dynamic position changes during the colonoscope withdrawal process, we can improve luminal distension scores, but this has so far never been translated into a demonstration that there is an improvement in adenoma and polyp detection by using changes of position during withdrawal. And therefore that was the reason for the present study.
What methodology did you use to achieve these results?
We chose a back-to-back double intubation study technique where patients were randomized either to examination first in the left lateral position and then with position changes, or with position changes first and then in left lateral, and any polyps detected in either of those two examinations would then be removed at a third intubation. This was performed as a segmental withdrawal, and the position changes used were left lateral for examination from cecum to hepatic flexure, supine position for the transverse colon, which lies relatively anterior in the abdomen, and then right lateral for splenic flexure and descending junction. And the back-to-back design helped us with the statistical to give the study statistical power, so that we would be able to detect a difference in adenoma detection. And we also looked at luminal distension scores to see whether these correlated with the polyp and adenoma detection, to try and give us some kind of handle on how, if we found an effect, how position change might be helping.
What are the key results from your study?
The key results, or from the primary outcome measure, was that there was an 11% absolute increase in adenoma detection in the area where position changes were used, so that's between the hepatic flexure and sigmoid descending junction, and that luminal distension was correlated with adenoma detection. In poorly distended segments, adenoma detection was about half as good as it was when the lumen was well distended. So it looks like at least part of the mechanism for the way position changes help is through improved luminal distension.
What do you think should come next from this work?
Well, I think we need to accept that this was a single centre study with a single operator, and so these data will need to be replicated in other units, and there are some particular features of colonoscopy at St Mark's Hospital in that we use carbon dioxide and antispasmodics with hyoscine butyl bromide for all patients. which are not necessarily used in all other units, and so it will be helpful to replicate this work, which very much really represents a proof of concept that the idea that position changes might improve polyp detection is worth taking forward.
And what would a take-home message be?
Well, I think the take-home message from the study really is that dynamic position changes during colonoscope withdrawal, which are essentially a cost-neutral intervention, appear to improve adenoma and polyp detection, and hence are potentially a way to improve colonoscopic quality.
Thank you very much, Dr. East.